By way of introduction, I'm James Delaware, and I work for the Palladium Group International with a project called MFGAP. So our work, I will be describing my understanding of the topic on the basis that 27 years ago, I was a nurse in the health sector. I was particularly touched by a few words on the topic. One, sustainability, and the two is inclusive recovery. To begin with, there are key factors we need to consider as the fundamental issue leading to the COVID-19 and the consequences we continue to suffer as a people in society. And the key factor for me is the unequal distribution of resources and power among different people of society. So you will consider the rich, the poor, the disabled, the physically challenged, people with mental illness, and what have you. So as long as there is an unequal distribution of resources, we will continue to experience the situation of the COVID-19. I take you back to the outbreak of the Ebola in 2014. It was more concentrated in West Africa, and because of its local effect, we had many international organizations pouring in different resources to assist Liberia and other countries in West Africa. However, with the support received from the many countries that came here, it was the local resilience that helped us to deal with the Ebola situation. Now, because we stood together as a nation, and not just Liberia, but our neighboring countries, were able to deal with the the Ebola. There were some best practices that today we don't exercise. For example, shaking hands, hand washing. We did all of those, and it helped us to deal with the Ebola. On the issue of sustainability, then we need to question ourselves, why have we forgotten those practices that help us to deal with the Ebola? Let's look at the COVID-19. When it was first reported, we heard that developing countries would have suffered the most. I remember hearing that in developing countries, people will walk the street dying by the day in their hundreds. It might be probably the blessing of God. We didn't get to experience that. And what we saw was completely the opposite. We have more people in the developed world dying from the COVID-19 than expected. So we in the developing country may have probably been blessed. But if one sector of the world is unsafe, there is no part of the world safe. Let's take the COVID-19 effect in the West. While it was not killing us as it did in their country, we still suffer it. In fact, what was interesting is that while we were reporting cases here, there was not much talk about sending relief to us. The West was more concentrated on helping their population than helping the developing countries. this should serve as a lesson to all of us that the COVID-19, though we didn't suffer it like they did, but we need to understand that there were practices that help us to deal with the Ebola that we need to continue. We have forgotten to sustain the practices. And that's why I said there are key words that encourage me to speak to this topic. And that's sustainability. The next one I want to look at is the inclusive recovery. The inclusive recovery that we talk about. How are we getting, for example, people with disability, the poor people we have in our country involved in the fight against the COVID-19? We didn't see much of that. We didn't see much of awareness going on like we did for the Ebola. So there is a need to ensure that the inclusiveness we talk about will consider the poor, the rich, and everybody of our society. The use of masks, as we sit in here, interestingly, a lot of us wearing masks. And this is a forum that is going to be taken out. So we are guilty of now practicing some of the sustained. All nations, including Liberia, must begin its preparedness for health emergency, setting aside good sum of money from the national budget, only to be applied when we have medical emergencies such as COVID-19. We must treat the issue of COVID-19 as a cross-cutting issue, like we treat other social concerns. Every program, every other work that we do as a nation, from ministry to agency to international and local NGO, we must make sure we include the continuous practice and awareness raising among our people. On that note, I will stop here. Thank you.
Thank you so much. Thank you so much, Mr. Tiller. We'll go straight to the next panelist. Chief, introduce yourself.
Okay. By the way of introduction, I'm Gabriel F. Nimba from Manuel Youth Parliament. Shortly, in discussing these issues about the pandemic, which is COVID-19, I would like to stress on the achieving. How can we achieve the recovery? In terms of all to achieve the recovery, we let us firstly focus on the rules and regulations that is governed to this pandemic. If we don't follow the rules and regulations, we cannot achieve this particular pandemic. In doing so, we have to focus our attention on the aspect of the recovery. In this content of the recovery, we have two types of recovery. We have the short-term recovery and we have the long-term recovery. In the Western world, in the Western world, more people, like for instance, we have the estimate of 13 million people are still on the long-term recovery. The long-term recovery, because if you have the disease, it directly deals with your lungs and the inner part of you. And those who have a long-term recovery, this is caused because of lack of strong immune system. And in those areas that I speak of, like for in the western side, this is done because more people that was attacked by this various disease, they were of old age. And as that, their immune system, it is not as strong as compared to those between the ages of 20 to 35 or 40. So in more cases, you will see people recovering faster at the ages of 18 or at the age of 18 to 35 or 40. So in our country, how can we achieve this particular thing in that for all to recover we have to achieve? How can we achieve it? We can achieve it, as I said from the onset, if we focus our key points on educating the minds. In terms of making awareness, in our country, more often when things come out, we will see that you will go on radio and people will play music around. But are we educating the various minds? If we are not educating the various minds, that is one of the assets that we can use to recover from this COVID-19. If we listen from the onset at the time when the coronavirus was in this country, everybody was moving from here, there, giving awareness. Is this still going on? Definitely, you would not see it going on. But as for us, we that even here, we are educators. So we can use this means to educate the minds of the various people we interact with. In that, we definitely achieving. Because if you want to achieve something, know the implications of why you are about to achieve.
Yeah.
So definitely, if we abide by the rules and regulations, washing our hands regular, even keeping our community safe, in terms of our way, the place we reserve, we have to keep it clean. If we keep our hands clean and also give social distance, know who come and go out of our various homes, we will keep safe from this pandemic, even in exception of COVID-19, if anyone is to come. So my only suggestion onto it in achieving is that we should make our focus to the rules and regulations that governs us in terms of, because the Ministry of Education gave us the rules, and all these rules, will follow them, we can recover. But minus following these rules, we cannot recover from any other thing. Thank you very much.
Thank you very much. Rules, enforcement, recovery. Madam, we would like to turn over to you. From your perspective, you please pass it back to us. From your perspective, how do we improve our recovery from this COVID?
Okay, again, my name is Nelly G. Tool. I work for National Union Organization of the Disabled. I call the local Nimba Ganta. I would like to appreciate Stockholm+50 national consultations Liberia for this great opportunity to express ourselves. I was told that I will be presenting on the achieving a sustainable and inclusive recovery from the coronavirus disease, COVID-19 pandemic. It is an excellent idea and opportunity. To start with, as we have been told by experts from the health authorities, and other COVID-19 epidemic. It is an accident. We have been told by experts from health and other relevant authorities the coronavirus disease is considered as a breathing sickness which travels from infected person to another. This considered as a all people to other people who does not have the virus through close contact. We were told to cover our nose, our mouth when sneezing or coughing, to avoid coming in contact with the saliva from an infected person. That was the time compulsory wearing of nose mask or face masks or experience. We were also told to avoid overcrowdedness and observe social distancing. During this time, we persons with disabilities, PWDs, were challenged. In some cases that people will go to carry on awareness, they will not allow persons with disability to be part, because if our colleagues see all in that awareness, they will surely listen to us. But sometimes they leave out with this awareness. Even the COVID-19 vaccine, when they were carrying on awareness, persons with disability was not part. So if we go in our meetings, some of them will say, well, what they are saying, we cannot see people with disability on that platform to talk about this virus. And I know you who are the us are not taking this virus. They cannot take this virus. Some of them even take virus. We want to talk to them, but it was very difficult for them to listen because we were not part of the awareness. So during this time, we too took the initiative to sensitize our people about hand washing, wearing a nose mask, social distancing, and reporting the sick people to the relevant health authority for quick health intervention. Those things we did. We did not stop there. Through the help of our partners, like Alpha Liberia, that I'm working with as community worker, help us to distribute COVID-19 preventive materials like chloride, powder soap, washing hand buckets, nose masks, and among others, to fight the virus. How to achieve a sustainable and inclusive recovery from the coronavirus disease epidemic is a strategy that can be empowered by the government and her partners by involving all sectors. Like what I said, all sectors, be disabled or able, be or poor, you should be included in the society to carry on this awareness for other people to listen to you. Let this initiative be cross-cutting. Like we always say in our organization, there is nothing for us without us. Our group should be included in policy drafting and implementation to end this pandemic. As of this, we have a center in Stockholm that was constructed by Nimba County Project Management Committee with the amount of $40,000 United States dollar with the Nimba people's money. This center, when turned over to the disabled community of Nimba, will be used for meeting, training, and dialogue concerning the priorities in the county. So you see, we are a group, responsible people who are contributing to our society. Therefore, involving us in the fight against the epidemic is a milestone in endeavors. If we are covered in whatever policy drafted to end the epidemic, this epidemic, our people who trust us will know that the document can be trusted, and what we mean is enshrined in that policy document. To conclude, persons with disability are important people in the larger society. They are as important in decision making. Those who are not disabled should also know this. Government and partners should always involve us, as we also have knowledge, experiences, and recommendations concerning the issue being discussed. Finally, many thanks to the organizations of this event, and we hope our recommendation I consider. Thanks for inviting us.
You as the person representing the UN now, what are your views, your perspective on how our recovery can be possible, considering all your panelists have made some points?
Okay.
Can you take the mic? Can you please step in with the mic?
Yeah. Okay, thank you. All right, again, Lovett, Michael, and from UNDP. So I want to say thank you to you who took your time to be here. And I just want to say something quickly and then hand this mark over. And this is something that we need to take into consideration. Why it is true that COVID-19 has caused the world too much of havoc, but the fact remains that there are also advantages of COVID-19. And here are some of the advantages that we get from COVID-19. We currently talk about the climate change due to greenhouse gases emission that goes into our ozone layer and depletes the layers of the atmosphere. During the lockdown, when COVID-19 was at its height, researchers told us that because of limited activities, because people were working remotely, because there were no people, many persons driving cars, driving trains to go from place to place, the emission of greenhouse gases dropped.
Yeah.
And because of that, we had cleaner air. People were breathing freely because the air was not polluted at the time. So then what can we learn from this? In as much as we know that we were confined to our homes because we could not go out for fear of death or for fear of being a victim of this coronavirus disease. But the fact remains that this was also a safety, not only for our current health, but for our future world. So then how can we implement these things? How can we make what we did or what we were doing at the time when COVID-19 was at its height? What can we do to ensure that this greenhouse gases emission is always reduced so that our future to come can also benefit from this beautiful world of ours? I want to talk about two things that we can do. Those two things is stop talking and start acting. Because we've talked too much. I mean, since 1972 in Stockholm, the world talked. And since over 40 years, 50 years now, we've been talking. We've been talking. I think this is a time that we start acting. Because, take for instance, even bigger countries, like countries who are industrialized, they are really people who are causing a depletion in the atmosphere. Because, take for instance, you have industries. One country probably have up to 40, 50 industries. And each industry is having machines. Those machineries are sending out some carbon dioxide and other things to the atmosphere that are causing trouble to the atmosphere. So now what we need to do is we need to forego some things for the future. If you want to have a better life, you have to forego some things in the present for a better future. So take for instance, the world have been talking that we need to reduce the emission of greenhouse gases, yet industrialized countries have not tried to reduce the amount of industries in our country. And the reason is because those industries are the source of income to them. In Liberia, we also have some few industries, and we have people burning coals, people burning things, which is also causing harm to the atmosphere. What we need to do is to start acting now. We have all of the policies. Let's do this, we've been saying it. Let's start acting on it. Currently, we say we're going to reduce the pollution in the air, the pollution in the waters, the pollution on land. But what are we doing to put into effect those things that we said? Let us now go digital and go to the next point. We need to go more digital and invest into technological advancements that will help to increase and to deliver us from future disasters. Now, what are some of the digital technologies that we need? Currently, you heard someone talk about the eco-friendly stove. People need to ensure that whatever you do, you're not doing it only for you, you're doing it for the future. During the lockdown, people were working from home, so cars were not too much on the street and were not causing harm to the environment. So why can't we learn from that? Take for instance, significant staffs go to the office, which will reduce, and then people who are now 100% needed at the office still need to work from home. But then there are disadvantages and there are problems that we need to handle. And that's why I said we need to invest into technological advancements. Take for instance a country like Liberia with limited electricity. If someone stays home to work, it becomes a trouble. So now, as a government, I agree that we've taken steps towards that, but we need to push up our efforts. Otherwise, we will have West Point to be wiped out, because currently we have up to 50% of West Point that's already out. And other places in Liberia will be wiped out. And the reason is not because, like people will say, vexed with Liberia. I don't want to believe it 100%, but the fact is, we are not taking care of our environment. Because we've been talking it and we're not doing anything, so we're gradually moving to a place when, if we don't act now, Liberia's land space will decrease drastically. That's not something like a prophecy, but that's something that's reality. That's something that's happening. So COVID-19 has taught us a lesson. To recover from it, we need to be inclusive. We can take few persons, like back then, thank God for now, young people have been included. The thing is, young people have ideas, young people have the skill, the energy to do these things. But if the older folks still want to remain in the stage and don't want to provide advice to young people to take on the mantle of authority, it becomes a difficult task. Take for instance, you have older folks in EPA. I'm not saying that's what they're now, but I'm saying for instance, if you have older folks in EPA who know all of the technical know-how, how to ensure that the environment is clean, after those people are gone, because no one will stay forever, what becomes of the young people who don't have the technical know-how? What becomes of our environment? Our environment will continue to be degraded because we don't have the people with technical know-how. So now is the time to include young people, people with disabilities, everyone to come together. The Sustainable Development Goals say, leaving no one behind. How can we ensure to implement the SDGs if we have people left behind? We have dirty cities, is because we're not working. The thing is, we need to work and we need to invest. If we invest into these things we're doing, and if we take ownership of these things we're doing, the fact remains that Liberia will be a better place, and our world will become a better place. So to summarize, we have 2 points. We need to be inclusive, we need to have digital and technological advancement included, and we need to stop talking and start acting. Thank you so much.
Thank you so much. Digital inclusivity, decentralize it as much as possible. Stop talking, start talking, leave no one behind. Let's be practical. Thank you so much, Mr. Weir. To you, the panel, to you, the audience, do you have questions? Do you have response? Do you have recommendations to Liberia's ability to respond to COVID-19, consistent with a healthy planet for prosperity for all? Does anyone have questions? Yes, I have you in the background.
So I have 2 points. The first.
Let's only take one because we don't have much time yet. Other people want.
It's not working, so I will just talk. So just to that, for what can we do to achieve inclusive recovery for the COVID pandemic. For me, I want us to look at the issue of social protection, right? So in Liberia, we have the ministries, we have civil society, we have other organizations, and even us as communities. Let us consider social protection, because there are no social protection currently that is ongoing that can really lead to this inclusive recovery. We have people with disabilities still challenged. We have women challenged. We have women and girls that suffer rape and other sexual and gender-based violence from the COVID period that are still going through that need for social protection. So I want us to look in that direction. Thank you.
I just want to rally around my colleagues to what they have said. I want to be thankful to them. The only thing I see is that we Liberians, we are complacent with the regulations. Right now, as we sit here, there is no, we don't have hand sanitizer with us. We don't have nose mask. Because we are complacent with the reduction of the COVID disease. Okay, so all these things are supposed to be meeting in order to sustain the slow pace of the COVID-19, the COVID-19. And what also we need to do is that as Liberians, we need to always not to shake hands. This time we can shake hands seriously. Why are we doing that? It means we are so complacent with the reduction. We need to be encouraged in order to maintain the regulations of CDC. Thank you.
Okay. My name is Ambrose, ABC Jamina from EPA, LOFA. When we talk about COVID-19 or Ebola, there's no way you can rule out waste management. EPA works in the 15 counties. There are some areas we carry out our inspections. For Lofa County, we have some health sectors, some areas where sometimes we do inspection. We've seen that there are sometimes copious amount of medical waste. And this medical waste are not actually properly paid attention to. So my question is leading to Mr. Teleweon. What effort is being exerted basically for when you go to Zozo district, you have a hospital there, Lutheran Quran Hospital. There's a huge amount of medical waste, like you have what you call, you have what you call expired drugs. You go to 4 years, you have expired drugs in those warehouses. What have you done? What effort have you exerted to make sure these materials are being properly disposed?
So thank you very much. Mr. Telewen, do you get the question?
Okay, I'm Christian Nat. This is not a question. It's just a recommendation. Yes, and when we talk about COVID-19, it's a zoonotic disease. This virus.
When you say zoonotic, what do you mean?
It's a virus that spread from animal and human.
Okay, so
yeah. So it's spread between animals and human. So definitely the animal can get it from the human being. Yeah. So we have to concentrate efforts in working with the animal sector, meaning with the Ministry of Agriculture and the EPA, and together we accelerate our efforts in working together on the One Health platform. Thank you.
My question to the panelists. I think we all heard very well, and the brother just tried to come in with it. Now that we are going towards reducing the COVID and we see that it is dropping, what role can we say that forest, wildlife have played in this process, and what message can we give out to the world if this is necessary in the COVID reduction process. Thank you.
Starting with Mr. Telewayon. Lofa.
Well, speaking directly to the question, I'm not sure my institution mandate is in the health sector, but I think, as we've said, the issue of health is a cross-cutting situation that we all have to face. And I've visited many of the counties, and I see around hospitals a USAID project, the Abbey incinerator, that will help health administrator to get rid of waste materials. Again, some of those projects are hanging, they are incomplete, and that's why we need national effort and huge budget allocation to the health sector. That's what I can say about that.
Thank you. Thank you so much. Increase health budget. Our colleagues here, do you want to respond to any of the points raised? Some people talk about One Health approach. Some people talk about, yeah.
Okay.
Yeah, you can go, Love it.
Okay, so thank you to the recommendations. I'm not going to say again because of time. Thank you to the recommendations, and we take into consideration your points. But with the last question about what forest, what are we saying that forest, the work that forest and other biodiversity is playing into the reduction of COVID-19, if I'm clear with your question. So I think what we need to do is, we already understand that forests help to clean the air, and we are clear that COVID-19 also is an airborne disease. That's why they say if you're sneezing, put your hand to your mouth and your nose, because if the saliva leaves, it flies in the air, and then if it comes in contact with somebody, it takes on the same disease. So the forest helps to clean the air. So if the forest cleans the air, I think that's one way, that's one thing, not scientifically proven, but from an observation, I think that's one thing why countries with good forests, like Liberia, who have up to more than 40% of the Guinea forest, I think that's one reason why our air is cleaner and COVID-19 is not as terrible as it is in other countries. So I think that's some of the roles that forest is playing in the reduction of COVID-19.
Thank you so much, Mr. Weir. I highly appreciate it. Sir, do you want to go to as well?
Yes. And more likely on the issue about the forest, just as my colleague just said, that is one of the key reasons that we notice now in our country, especially for the airborne disease, also for the clearance of the air. And most likely for the issues of this COVID-19, you see, in out of the day, you see about 50% of people that are ill, the symptoms of COVID-19 is also attached. But you have to look into it and see the stability of that, or that particular symptom, how many days it will stay up to you. So that will also distinguish to know definitely that the symptom you have, it is not definitely COVID-19, because all these symptoms, we've been having them before. So the forest is really helpful in our airborne disease. If it is not, that can actually help us for the clearance of the air.
Thank you so much. Ma'am, do you have points?
Yes, I would like to say something concerning the safe environmental issue. Because we are not only talking about forests, but even the erosion. There are some people, they can just look at their community with the erosion, thinking that maybe person with disability will not get way to pass, but they use that particular area to put the waste product for other people to get sick from that. So we also need to go back to our communities to talk to people that are involved in those activities.
Thank you so much. There is a special need. One of the takeaways from this panel is that people living with disability, whenever there is a national effort to address epidemics, whatever, our national education and awareness strategies must focus on inclusivity. We must always design response around how people living with disability must be included national effort for recovery, it's important that we be as generalized, decentralized, and we must stick to the rules for preventing. We must stick to the rules for preventing pandemics, invest more in health systems and recovery, prevention, and we must ensure that that is part of our national developmental planning. With that, I would like to say thank you to the panelists, thank you to the panel, and we will break straight and go directly to panel 3. Thank you so much, the team.